What if I told you that a single vitamin, one that most doctors rarely even test for, has been shown to reverse nerve damage in as little as 14 days, even in people over 60 years old? I know that sounds almost too good to be true. You've probably heard countless claims about miracle supplements and wonder cures. You may feel skeptical, and honestly, that's healthy. You should question bold claims, but stay with me. What I'm about to share with you is not internet hype. It's backed by clinical research, real patient cases, and decades of neuroscience that unfortunately mainstream medicine often overlooks. My name is Dr. Mandell, and if you've been dealing with tingling in your hands or feet, if you wake up at night with burning sensations shooting down your legs, if your balance feels unsteady, if your grip strength is fading, or if you've been told it's just aging and there's nothing you can do, this video might genuinely change your life. I'm not exaggerating, so please don't click away. Watch this all the way through because the information you're about to hear could be the missing piece you've been searching for. Let me paint a picture. Imagine you're 62 years old, you used to be active, you walked your dog every morning, you played with your grandchildren on weekends, maybe you enjoyed gardening or light exercise, but over the last year or two, something changed. It started subtly, a little numbness in your toes, you blamed poor circulation. Then came the tingling, it spread up your feet into your calves, your hands started feeling clumsy, you dropped your keys, buttoning your shirt became frustrating, writing felt awkward. At night, burning sensations kept you awake, you shifted positions, you rubbed your legs, nothing helped. You went to your doctor, they ran basic blood tests. Everything looks normal, they said. Maybe they prescribed gabapentin or another nerve pain medication. It dulled the pain slightly, but left you foggy, tired, and disconnected. Does that sound familiar? If it does, you're not alone. Millions of people over 60 are living with peripheral neuropathy, nerve damage affecting the hands and feet. And here's the shocking truth. The vast majority have never been properly tested for the one nutritional deficiency that could be driving the entire problem. The vitamin I'm talking about is vitamin B12. Now, some of you just thought, oh, B12, I take a multivitamin, I'm covered. That assumption is exactly what keeps so many people suffering unnecessarily. Here's what most seniors don't know. After age 50, your ability to absorb B12 drops dramatically. Your stomach produces less of a protein called intrinsic factor, and intrinsic factor is absolutely required to absorb B12 from food. So even if you eat meat, fish, eggs, and dairy, even if you take a standard multivitamin, you could still be severely deficient at the cellular level. And here's the scary part. Standard blood tests often miss B12 deficiency entirely. Your serum B12 might come back normal, but your nerves could still be starving. Why? Because the normal range is far too broad. Many neurologists and functional medicine experts now believe that the low end of normal is already too low for optimal nerve health. Every nerve in your body is wrapped in a protective coating called the myelin sheath. Think of it like insulation around an electrical wire. When the insulation is intact, signals travel quickly, muscles respond correctly, sensation feels normal, and balance remains steady. But when B12 drops too low, the myelin sheath begins to deteriorate, the insulation phrase, signals misfire. That's when you experience burning, tingling, pins and needles, numbness, weakness, and poor coordination. If the deficiency continues long enough, the nerve fibers themselves can become permanently damaged. That's why early detection is crucial. Here's the part that gets exciting. Multiple clinical studies show that when B12 deficient patients, even those over 60, receive the right form at the right dose through the right method, nerve improvement can begin in as little as 14 days. I've seen it personally. Patients who couldn't feel their feet report sensation returning within 2 weeks. People who hadn't slept through the night in months suddenly sleep peacefully. Balance improves. Grip strength returns. It's not magic, it's biochemistry. Your body wants to heal, but it cannot build what it doesn't have the raw materials for. And B12 is one of the most essential building blocks for nerve repair. Not all B12 is created equal, though. The most common form in supplements is cyanocobalamin. It's synthetic, it's cheap, and it requires multiple conversion steps before your body can use it. For many people over 60, especially those with genetic methylation issues, it's simply not effective enough. The forms you want are methylcobalamin and adenosylcobalamin. Methylcobalamin directly supports myelin repair and helps produce SAMe, a compound critical for nerve regeneration. Adenosylcobalamin supports mitochondrial energy production, and nerves require enormous energy to heal. Ideally, you want both forms. Dosing matters a lot too. The recommended daily allowance for B12 is about 2.4 micrograms. That's just enough to prevent severe deficiency disease. It is not enough to reverse nerve damage. Clinical studies often use 1,000 to 5,000 micrograms daily, sometimes higher in early treatment. For severe cases, B12 injections 2 to 3 times weekly can accelerate results by bypassing the digestive system entirely. After improvement begins, many people transition to high-dose sublingual B12 absorbed under the tongue, which bypasses stomach absorption issues. B12 is critical, but it works best as part of a team. Benfotiamine is a fat-soluble form of vitamin B1 that penetrates nerve tissue better than regular thiamine. It protects against advanced glycation end products, toxic compounds that damage nerves, especially when blood sugar is elevated. The recommended dose is 300 to 600 milligrams daily, and it has been extensively used in Europe and Japan for diabetic neuropathy. Vitamin B6 is essential for neurotransmitter production, but be careful. Too much can actually cause nerve damage. Stick to 25 to 50 milligrams daily using the P5P form and avoid megadoses unless supervised. Alpha-lipoic acid has been used in Germany for over 30 years to treat neuropathy at 600 milligrams daily. It reduces oxidative stress, regenerates other antioxidants, improves nerve conduction, and decreases burning and numbness. Vitamin D receptors are found throughout the nervous system, and low levels are strongly associated with neuropathy. Target a blood level of 50 to 70 mmol with a typical dose of 4,000 to 5,000 IU daily alongside vitamin K2. Finally, magnesium supports over 300 enzymatic reactions, calms nerve firing, reduces inflammation, and improves blood flow. The best forms are magnesium glycinate or magnesium threonate at 300 to 400 milligrams daily. Many seniors are deficient due to medications and soil depletion. Supplements help, but lifestyle heals. Blood sugar control is essential. You don't need to be diabetic to damage nerves. Prediabetes and insulin resistance are rampant. Elevated glucose forms toxic compounds, creates oxidative stress, and damages the tiny blood vessels that supply nerves. Reduce refined carbs, eliminate sugary beverages, and focus on vegetables, healthy fats, and protein. Monitor your fasting glucose, A1C, and fasting insulin. Movement matters too. Exercise increases blood flow to nerves and stimulates nerve growth factors. Even 20 to 30 minutes of daily walking helps. Studies show moderate exercise reduces neuropathic pain by up to 30%. Start small and be consistent. Prioritize sleep, as most nerve repair happens during deep sleep when growth hormone is released and toxins are cleared. Aim for 7 to 8 hours nightly in a dark room with no screens before bed. Finally, manage stress. Chronic cortisol damages nerves and raises blood sugar. Practice deep breathing, meditation, prayer, nature walks, and social connection. Stress management is medical treatment for your nervous system. A 67-year-old retired teacher came to me with 3 years of worsening neuropathy. She was on gabapentin and had been told her condition was idiopathic, meaning unknown cause. Her B12 was technically normal, but her methylmalonic acid was elevated. Her homocysteine was elevated. Her vitamin D was 18, which is severely low. Her insulin was elevated, and her magnesium was low. We started methylcobalamin injections, benfotiamine, alpha-lipoic acid, magnesium glycinate, vitamin D3 plus K2, a lower glycemic diet, and 15-minute daily walks. Within 14 days, her burning had reduced by 50%. At 6 weeks, her hand function had improved. By 3 months, she was walking 30 minutes daily, sleeping through the night, and had come off gabapentin under medical supervision. Every case is different, but the body's capacity to heal even after 60 is extraordinary. Test your B12, methylmalonic acid, and homocysteine levels. Consider 1,000 or more micrograms of methylcobalamin daily. Add benfotiamine at 300 milligrams. Add alpha-lipoic acid at 600 milligrams. Optimize your vitamin D. Ensure adequate magnesium. Control your blood sugar and move daily. I'm not telling you to stop your medications. I'm not telling you to self-diagnose, but I'm telling you this. B12 deficiency is massively underdiagnosed in people over 60, and correcting it can change lives. Your body is not broken. It may simply be missing something essential, and when you provide that missing piece, healing becomes possible. If this gave you hope, hit the like button and subscribe for more information your doctor may not have time to explain in a 15-minute appointment. Share this with someone struggling with nerve problems and drop a comment below with your experience. This is Dr. Mandell reminding you that aging is not the same as deterioration. Sometimes it's simply deficiency. Take care of yourself, take action, and I'll see you in the next one.